are listening to the Mariam Konda Show on Salam Media. If you've just joined us, well, welcome. And you've missed out on the first part of the show, but that's okay. You can always catch up a little later on. Anyway, it is time for our health discussion, and today we're talking about anemia with Dr. Nqobile Sithole, who is joining me on the line right now. Good day, Dr. Nqobile. Thank you for joining me. Dr. Nqobile?
Yes, I can hear you clearly.
All right, now I can hear you. All right, thank you for joining me. So, what is anemia and what causes a person to become anemic?
Anemia is a medical condition. By layman's term, it's actually a lack of blood. In actual fact, there is a shortage of specific composition in the blood, which is called hemoglobin. So the lack of that chemical substance that's found in the blood results into shortage of oxygen that's transported to the cells.
Mm-hmm. So you mentioned that it is a lack of blood. So what do people mean when they say that they have low blood?
So, like I said, the active component of the blood that we look at is hemoglobin. So, due to various reasons, people can lack hemoglobin. It can be, hereditary, where somebody is born, with deficient hemoglobin or with some disorders affecting red blood cells. Or it can be acquired, which can be related to nutrition when people are not taking enough iron sources, because iron is that building block of red blood cells. It can be due to medical problems as well. Anyone that suffers long-term illnesses like cancer, any chronic conditions of the heart can actually result to anemia.
Mm-hmm. And what are the symptoms of anemia?
Symptoms of anemia can be generalized symptoms. People may feel dizzy and they may feel always tired, lightheaded. It can be symptoms that affect the heart, like a fast heart rate or palpitations. They can actually have skin pallor, and in severe anemia, they can present with shortness of breath, which can actually be a sign of an underlying heart failure as a result of the anemia.
So basically, if a person is feeling or rather having these type of symptoms, then they should go and get checked for anemia.
Yes, importantly, people should go and have a full checkup. Doctors can do what is referred to as a bedside hemoglobin test, where they can prick a finger, just like a sugar test. There is a HB analyzer that can tell the level of hemoglobin. Sometimes they can do a full blood count, which actually tells more details, which can even tell the type of anemia that somebody has.
Speaking about that, I came across something called sickle cell anemia. What type of anemia is that?
Sickle cell anemia is a type of hereditary anemia. In fact, it's a term that's given to a group of disorders, inherited disorders, where the red blood cell structure is abnormal. So it looks like a sickle. That's why the anemia is called sickle cell anemia, the shape of the red blood cell. As a result, the blood cell is unable to work properly because it's so dependent on its shape to actually be able to have that oxygen carrying capacity.
Can anemia become dangerous if left untreated?
Yes, like I've said, that some people can develop complications of anemia. So if anemia is left untreated, people can develop complications of anemia. And the one complication that we have gone through is cardiac failure, where people actually go into heart failure, because what happens in the body when you don't get enough oxygen into the cells, the body thinks that the problem might be with the heart or with the blood volume. Let me put it that way. So when the body perceives lack of oxygen in the cells, it interprets it as if there is a problem with the amount of blood that's getting there. Meanwhile, the problem is the quality of the blood that's getting there. And so it overworks the heart to pump more blood. And obviously that does not solve the problem of anemia, because the problem is with the quality of the blood rather than the volume or the amount of the blood. So your heart just continues to pump fast, hence you get symptoms of fast heart rate, palpitations to try and compensate for the anemia. Eventually the heart, it can no longer pump enough blood, because as the heart is overworked, it thickens, and the thicker the muscles of the heart become, it just gives up. So the person may have progressive shortness of breath that is now just more than the anemia itself, because they may have swelling of the legs, which are now signs of heart failure. Problems with sleeping flat. When they lie flat, they just feel severe shortness of breath. They may have to use like 4 pillows to try and alleviate that shortness of breath.
You mentioned about the quality of blood that an anemic person needs to receive. So what does the treatment involve?
So the treatment depends on the level of anemia or the degree. So when we look at particularly the hemoglobin level, it's just a scientific way to measure this quality of the blood that we have discussed. So if your hemoglobin is below 7, and you are not pregnant, because that's another scenario where you find that people that are pregnant are prone to anemia. So if the person has a hemoglobin of less than 7 and they are not pregnant, and they are symptomatic, meaning they are short of breath, they can't stand, they are so weak, they look so pale, and they may have an underlying problem or not, it may be an indication for them to go on a blood transfusion. So that's why we donate blood, so they can receive blood, so that blood is able to give them the quality in their blood where it can actually increase their hemoglobin. Depending on also if it's someone that is just anemic, but they are fine, they don't have any complications, or they are coping, they can go on to iron supplements in the tablet form.
I have a question here from Facebook. They would like to know if anemia can cause severe headaches.
Yes, in fact, headaches is one of the symptoms in which anemia presents.
All right. And how often do blood transfusions have to occur?
Importantly, we need to find the underlying cause of the anemia. So, and try and treat that underlying cause of the anemia. So unfortunately, if it's chronic disease, or if anemia is secondary to any other chronic disease, importantly, it's to treat that underlying problem. For example, we've mentioned cancers because of the amount, or even cancer treatment like radiotherapy and chemotherapy. In that group of patients, unfortunately, it's the underlying problem that needs to be sorted out first, and then the problem of anemia is sorted. But in terms of the amount of blood transfusion, your doctor may recommend more than once or twice, the amount of blood transfusion depending on the need.
And can anemia go away, or is it a chronic life disease?
Anemia in most instances is curable. Like I say, importantly, it's to treat the underlying problem. Things like nutritional anemia, with some iron supplements. I actually forgot to mention that you can even get transfused with iron supplements in the drip form. And that has been found as a substitute, especially to those people. Some people, for religious reasons, are against blood transfusion, or they cannot have blood transfusion. So there are those treatment modalities, and they work fine, quite perfectly and fine in terms of substituting iron.
And then when it comes to diets, what foods should we eat, and what should we avoid, especially for those who are already anemic?
Importantly, I'll just focus on the foods that are rich in iron. It's important for people to have green leafy vegetables. And we find the anemia deficiency is another problem, especially with people that are vegetarian. So it is recommended on anyone who is already, a vegetarian, who are really exclusive of all animal products, to routinely take iron supplements before they even get to a point where they need to be transfused or where they are diagnosed with chronic anemia, because that's one of the commonest causes. But in people that can have meat products, your liver, beef are very good sources of iron as well. Like meat products are very good in iron. And we find that even dairy products, a lot of them have what is called complementary iron. So as part of the government regulations, they have been forced to modify this food, especially the staple foods, our cereals. They all contain good sources of iron.
Mm-hmm. Earlier on, you mentioned that pregnant women can get anemia. What about someone who is not pregnant and in their adulthood? Can they get anemia?
Yes, unfortunately, with the female individuals as well, they are prone to anemia. It's obviously due to the loss of blood during their, monthly period. So sometimes that can be so severe that it can cause anemia. So those are the people to actually watch out and check their hemoglobin regularly.
Mm-hmm. All right, we're going to leave it there. Thank you so much for your time once again, Dr. Nqobile.
Thanks for having me.
That was Dr. Nqobile Sithole talking about anemia. If you have any of the symptoms that she has mentioned, do go out and go and get yourself checked out. I have a comment here from Hajra Motawum. Shukran, Sister Mariam. This is so beneficial. I have clarity on so many things which I was struggling with in regards to myself and daughter. Shukran, Jazakallah. May Allah reward you. Excellent show. Shukran, alhamdulillah, and also for tuning in and always tuning in on the show. Do leave your comments in the comment section below. And also, if you have further questions for Dr. Nqobile, you may send them to us on WhatsApp. The number is 061 766 0355, and she'll gladly answer them for you. As women, we are more prone to getting anemia because of the monthly period that we have. So if you have any of the symptoms too, please do get yourself checked out. Just stay with us. We will be right back.
This is Salam Media, and